turn to Dr. Walensky for an update on the state of the pandemic and on the Johnson & Johnson pause, followed by Dr. Fauci, who will also provide his perspective on J&J. As you know, yesterday, the FDA and CDC announced that out of an abundance of caution, they have recommended a pause in the use of the Johnson & Johnson vaccine as they review data involving 6 reported U.S. cases of a rare and severe type of blood clot in individuals after receiving the J&J vaccine. I want to be clear that this announcement will not have a significant impact on our vaccination program. The J&J vaccine makes up less than 5% of the more than 190 million recorded shots in the arms in the U.S. to date. The President has always said that we are at war with the virus. And as such, we have mobilized a wartime effort so that we're prepared for a range of scenarios and contingencies. This is why the President took aggressive action earlier this year to move up manufacturing, production, and delivery schedules for both the Pfizer and Moderna vaccines, and to secure enough Pfizer and Moderna doses for 300 million Americans by the end of July. Over the last few weeks, we've made more than 25 million doses of Pfizer and Moderna available to states, tribes, and territories, and through federal channels each week. In fact, yesterday we announced that this week we will make 28 million doses of Pfizer and Moderna available. And as we've done from the beginning of this administration, we will continue to get supply out the door as soon as it's available. Importantly, this means we have more than enough supply of Pfizer and Moderna vaccines to continue the current pace of vaccinations, meet the President's goal of 200 million shots by his 100th day in office, and continue to reach every adult who wants to be vaccinated by the end of May. We are working now with our state and federal partners to get anyone currently scheduled for a J&J vaccine quickly rescheduled for a Pfizer or Moderna vaccine. We're seeing this take place across the country. The President has committed to the American people that his administration will always lead with science, tell the truth, and give Americans the facts as we know them. Over the past 24 hours, we've been working to provide clear information to the public related to the J&J pause, engaging state and local health officials, governors, community leaders, clinicians, and medical experts. And our public health officials will continue to appear on television, radio, and social media to communicate directly to the American people, so Americans have the latest information and answers to their questions, and the opportunity to learn more about the safety and the efficacy of the vaccines and the importance of getting vaccinated. Stepping back, building vaccine confidence, and increasing access to vaccination is central to our efforts to put this pandemic behind us. That's why we've invested $3 billion to help states and community-based organizations build vaccine confidence, particularly in the hardest hit and highest risk communities. We are getting fact-based messaging and resources into the hands of trusted local messengers. And it's why we are making data on the state of the pandemic publicly available, holding these regular press briefings, and are committed to sharing the facts at every turn. Yesterday's action should give the American people confidence in the FDA and CDC, the thoroughness of their review process, and their commitment to transparency and protection of public health. We believe that by empowering Americans with data and facts, we will strengthen the public's trust in government and increase their confidence in the vaccines. In terms of an update on our vaccination program, our vaccination efforts continue to accelerate. In total, more than 122 million Americans have already received at least one shot, and more than 75 million Americans are already fully vaccinated. As you can see from our weekly progress report, our vaccination program is accelerating. Our current 7-day average is 3.3 million vaccinations per day. When I last spoke at this briefing last Friday, the 7-day average was 3 million. So once again, strong progress. In the very short term, we do expect some impact on daily averages as sites and appointments transition from Johnson & Johnson to Moderna and Pfizer vaccines. However, I want to be clear that we have more than enough Pfizer and Moderna vaccine supply to continue or even accelerate the current pace of vaccinations and meet the President's goal of 200 million shots by his 100th day in office. In closing, we still have a lot of work to do. As the President has said, the war against COVID-19 is far from won, and we need everyone to do their part. So please, please wear a mask, socially distance, and get vaccinated when it's your turn. With that, I'll turn it over to Dr. Walensky. Dr. Walensky?
Thank you so much. Today, I would like to discuss what's on everyone's mind, our recent announcement to recommend a pause on administering the Johnson & Johnson vaccine at this time. But first, I do want to share with you where we are in the context of the pandemic. Yesterday, the CDC reported 61,000 new cases of COVID. As such, CDC's most recent data show the 7-day average of new cases has continued to increase, now 6% over the 7-day period, with a 7-day average of 67,530. Hospital admissions also continue to increase. The most recent 7-day average, a little over 5,400 admissions per day, is also up 6.8% from the previous 7-day period. And unfortunately, there were also 569 deaths again yesterday. Now, I want to switch topics to the decision we made yesterday to pause administration on the Johnson & Johnson vaccine. I have always told you I'm going to tell you the truth, and I'm going to lead with science. And today is, once again, one of those moments. CDC and FDA were alerted to 6 cases of rare types of blood clots called cerebral venous sinus thrombosis that occurred in combination with low levels of platelets, or a condition known as thrombocytopenia. 2 individuals with these blood clots also had clots in their abdominal cavity, or the veins of their gastrointestinal tract. The cases were reported to the Vaccine Adverse Events Reporting Systems, known as VAERS, which is a system that CDC and FDA co-manage to serve as an early warning system to monitor the safety of vaccines. All 6 individuals with these clots were women between the ages of 18 and 48, and their symptoms presented 6 to 13 days after they were vaccinated with the Johnson & Johnson vaccine. These reports of cerebral venous sinus thrombosis and thrombocytopenia are similar to reports of thrombotic events with thrombocytopenia seen in Europe after vaccination with the AstraZeneca vaccine. In the European cases, both men and women presented with the blood clots, though they were more frequent in women. The AstraZeneca and Johnson & Johnson vaccines both use an adenovirus vector. These vaccines are different from the Pfizer and Moderna vaccines, which are mRNA-based vaccines. And to be very clear, these types of reactions, blood clots in combination with low platelets, are not being seen with the authorized vaccines from Pfizer and Moderna. I want to take a step back and explain how these events fit into what we know about the Johnson & Johnson vaccine. Our latest data shows that we have administered more than 7.2 million doses of Johnson & Johnson vaccine and have yet observed only 6 of these cases. Right now, we believe these events to be extremely rare, but we are also not yet certain we have heard about all possible cases, as this syndrome may not be easily recognized as one associated with the vaccine. CDC and FDA are working rapidly to investigate each case and understand whether there is a causal relationship between these blood clots and vaccine administration. The decision to pause administration of Johnson & Johnson vaccine was made specifically for 3 reasons. First, we want to alert the healthcare providers to be on the lookout for these rare events post-vaccination and to make sure that they are treating patients appropriately. It is imperative for healthcare workers to know that the treatment of these clots is different than our current standard of care. While we would typically treat blood clots with a medication called heparin, heparin and its derivatives should definitively be avoided in the treatment of these clots while an investigation of the cause is ongoing. Second, there may be additional cases to report. We want people who have received a vaccine and their healthcare providers to be aware of these events and report them to the CDC and FDA through the VAERS system. And third, the pause will allow our independent committee of scientific experts to review the safety information on this vaccine and these events to determine their significance.